Welcome everyone to day 2 of the Metabolic Wellbeing Masterclass. My topic is the key role of herbs in type 2 diabetes. The worldwide prevalence of diabetes, largely type 2 diabetes, is predicted to rise to at least 5.4% in a few years. That's more than 400 million people. But this percentage, as I'll show you, will be much higher in the US. Type 2 diabetes is the end result of sustained insulin resistance in genetically susceptible people. Long-term, poorly controlled type 2 diabetes is a crippling disease that, via attack on the fine blood vessels, destroys key structures in the body that can lead to blindness, kidney failure, and even limb amputation. It's also a significant risk factor for other chronic diseases like Alzheimer's disease, heart disease, and cancer. Now, the information on type 2 diabetes is exploding with thousands of papers published every year. We desperately need access to this very latest information, especially for the herbs, so we can bring the very best to our patients' care. Not only will this up-to-date information benefit your patients, it also represents a real opportunity for ourselves as natural practitioners to lead this field at a clinical level. We are indeed at the cusp of revolutionary changes in the medical understanding of type 2 diabetes, and based on this new understanding, herbs have a significant role to play. One key change is a widespread acknowledgement that type 2 diabetes is in fact reversible. And there have been studies, I won't actually cover those, that show that diet and lifestyle can help with this. It's being acknowledged that it's reversible. Now, you might be thinking that I've put forward an ambitious agenda, or I'm exaggerating the clinical practicality of today's information. Or perhaps you're wondering if my talk will focus on complex and expensive protocols for your patients that aren't realistic to put into practice. And what about the issue of herb-drug interactions? Do we need to worry about this? So let's listen to the modern evidence, and especially how some of these new discoveries support our traditional insights. I invite you above all to reflect on the potential of this information for your clinical practice. You will notice an important therapeutic strategy coming through, and that is to truly understand a complex disease such as type 2 diabetes, we need to embrace the complexity of the multiple factors involved, and more importantly, use a complex, multifaceted intervention. And this is in fact the application of what we're now calling functional herbal therapy. So let's begin by looking at the rising incidence of type 2 diabetes with a US focus. So this map gives you the percentage increases expected in various regions around the world from the year 2013 to 2035. And you see everywhere it's expected to increase. Quite dramatically, for example, in South America, a 60% increase, and in the US, a 38% increase. If we look at the current, at the time of publication, which was up to 2016, the current US incidence of diabetes, you can see that overall, it's considered to be a massive 14%, composed of 9%, approximately almost 10% of known cases, with about 4% of undiagnosed cases. And as you can see, moving along the graph, more in men than in women. Now, it's very interesting if we age stratify this US incidence of type 2 diabetes and look at the category of age 60 and over. And there you see it's massive, isn't it? 21% diagnosed with diabetes. Now, this does include type 1 diabetes, but the majority of these cases are, of course, type 2 diabetes. And another 7% undiagnosed, leaving a total of 28%. So 1 in 4 people, 1 in 4 of your patients have this significant health problem. So before we begin to look at herbs and how they can help, it's worthwhile to look at a couple of foundation concepts and also to discuss type 2 diabetes at a pathophysiological level in terms of assigning specific cellular and systemic targets. So this is what we'll cover first. But the point I want to emphasize in this first section is that the key complications of type 2 diabetes, being both the macrovascular damage and the microvascular damage, is why this is a serious disease. A high HbA1c never killed anyone. The main reason why we need to address type 2 diabetes is because we want to stop them getting heart disease, heart attacks, strokes even, and also this microvascular damage with damage to the retina, to the nerves, and to the kidneys. And I would put it to you that any strategy, I'm not against glycemic control, I will discuss that soon, but any strategy that's just focused on glycemic control, and by glycemic control I mean targeting a particular blood sugar level or a particular HbA1c, any strategy that is just focused on that is missing the point, because the point is this. This is why this is a very serious disease. We also know from my introduction that it's an inflammatory disease, and that probably explains the links to Alzheimer's disease and cancer as well as other pathways, but inflammation is a big part of that, so we'll talk more about that as well. So are the complications all about just having hyperglycemia, too much sugar in your blood? Is it all just about that? You can see on this diagram, they are definitely providing or proposing pathways by which hyperglycemia, high blood sugar, leads to vascular damage, which you see the grey box down the bottom. So you see there are a number of pathways such as the polyol pathway, the formation of advanced glycation end products, the upregulation of inflammation like nuclear factor kappa B and so on. These pathways are proposed and they put oxidative stress in the box, but of course it's much more than that. And that then leads to various types of damage to the circulation and even the blood cells, and that leads to the vascular damage. So that's been the theory for some time, that all you need to do to treat the complications, and the real reason why we're treating type 2 diabetes are these complications, that all you need to do to treat those is get good glycemic control. But how does that actually shape up in the real world? How does that actually shape up? Is it just about glycemic control? There was a big study, and it was done in the Lancet, so a very serious, highly regarded medical journal. And in that Lancet study, they came up with some surprising findings, and that was that intensive glycemic control, and this is where you're using multiple drugs to really get that HbA1c and whatever into a narrow range, probably has some beneficial effect on diabetic complications like non-fatal heart attacks and retinopathy, but there was no evidence to show that it prevented or slowed down progression of neuropathy or even kidney failure. And there was good evidence that it didn't affect overall death rates and stroke rates. They weren't reduced by this strategy. And there was a suggestion that intensive glycemic control with drugs might even increase the risk of heart failure. So we're at a distinct advantage here, because we, as well as helping with glycemic control, and there are many herbs I'll be talking about soon that do that, we can also provide herbs to work around these other factors that might be at play that lead to these important complications of type 2 diabetes. I think the first thing to say is that vascular damage in type 2 diabetes is probably not just about high blood sugar, but it's a reflection of metabolic disturbance. And as you can see in the diagram there, one of the things that they're looking at, and has even been described as, the missing link in understanding type 2 diabetes in recent papers, is this methyl glyoxal. You could see there are a number of things that feeding into the diagram that cause methyl glyoxal. Inflammation, hyperglycemia are one, but not in the diagram, but fundamentally important is that methyl glyoxal is a metabolite of fructose. It's produced in fructose metabolism. And so one of the things that I always take care with patients with type 2 diabetes, now, even if their HbA1c is well controlled, I look at their fructose intake and how are they going to be getting that? Well, possibly with cane sugar, with corn syrup, and by eating too much high fructose fruits. So I'm not saying that people with type 2 diabetes should not eat fruits. They are hugely beneficial, but we should be selecting those low fructose fruits, for example, berries, in preference. So what other things that we can say? That in fact the vascular damage in type 2 diabetes is likely to be due to a combination of factors reflecting metabolic disturbance, such as deranged lipids, nutrient surges when someone has a high sugar, high fat meal that acts like sandpaper to the lining of the arteries, metabolic toxins like methyl glyoxal, and inflammation. And if you're not addressing that whole picture, that totality, that mosaic, you're not going to get results in terms of microvascular and preventing microvascular and macrovascular complications. And that was certainly shown in that Lancet review. So particularly with methyl glyoxal, it can modify DNA and extra and intracellular proteins. It leads to advanced glycation end products and increased cellular stress and dysfunction. And if it's circulating in the bloodstream, what's the cells that it's most likely going to attack? It's those ones that are lining the blood vessels. So what can we do here? What evidence do we have that anything's going to help this situation? Well, we have what my friend and colleague Simon Mills calls the Indian paradox. So what is that? Well, we know that the prevalence of type 2 diabetes in India is relatively high with poor glycemic control. As you can see, average HbA1c is around about 9.2%. Yet looking at one microvascular complication, which is retinopathy, the eye complications are only 16.6% incidence in people with type 2 diabetes in India. And in Europe, Japan, the US and Australia, it's around double of that. So despite their poor glycemic control, why are the people in India protected? Why is their microcirculation protected from their high blood sugar? Well, it's probably the many spices in their diet, especially turmeric, cayenne, and ginger that support microcirculatory health. And early herbalists described ginger as a diffusive stimulant, directly pointing to its effect, beneficial thereof, on the microcirculation. There are several herbs we can talk about in the context of boosting microcirculatory health. Gotu-kola is a key one, but we also have grapeseed and ginkgo, and I combine that with my microcirculation diet. And to me, this is core therapy in anyone with type 1 and type 2 diabetes. The microcirculation phytonutrient diet, the 5-point diet, plus gotu-kola, ginkgo, and grapeseed extract. So if we look at gotu-kola, there's 2 controlled trials have investigated the activity of its active components, the triterpenoids, which are in the extracts that I use, in patients with the microvascular damage due to type 2 diabetes. The largest trial in 100 patients with or without neuropathy also compared the extract and placebo over a year in 40 healthy controls. And what they found was that gotu-kola was significantly more effective at than placebo at improving microcirculatory measures and reduce for example, the lower limb edema that resulted from microvascular problems. So I don't have time to go into all the evidence. It's all there in, for example, the textbooks like Principles and Practice and other presentations. But what I'm suggesting is that if we're going to do anything with a patient with type 2 diabetes, it should be looking at their microvasculature. Another important aspect, and you've heard yesterday about the role of bitters, for example, in fatty liver disease, is exploiting what is called the incretin effect. So what is the incretin effect? Incretins are gut-derived peptides. They're hormones, peptide hormones, that increase glucose-stimulated insulin secretion. So basically, they make the response of the body to ingested food containing sugar that therefore needs insulin, they make it more efficient. They basically tell the body, hey, there's some food in there that's going to release glucose into the bloodstream, so get ready, pancreas, to respond. That's what the incretins do. And it stands for intestinal facilitation is the word that's missing, facilitation of the secretion of insulin, hence incretin. Now, the incretin hormones, they're produced by a special class of cell called the enteroendocrine cells in the gastrointestinal tract in response, as I mentioned, to incoming nutrients. And they stimulate insulin from the pancreas. The two key ones are glucagon-like peptide, GLP-1, and GIP. Now, GLP-1, analogues of GLP-1 are now commonly used as injectable drugs for type 2 diabetes, and they're seeing wonderful results with weight loss as well and so on. But what can we do as natural therapists? Can we exploit the incretin response? And the answer is we can, because bitter herbs stimulate GLP-1. Now, we have test tube experiments to back this up, and you may say, oh, Kerry Bone's always saying don't rely on test tube data, and you're right. But in this case, because the bitter is in solution in the gut and is in direct contact via the gut with the enteroendocrine cells, this is one example where in vitro modeling is not far off the mark. And when we do in vitro modeling, say berberine via bitter taste receptor number 38 stimulates GLP-1. This has all been done in enteroendocrine cells. We find that gentian has done the same thing, but also is a different species of gentian, but it contains similar phytochemicals to the gentian we use. And it's also done it in vivo, in animal models. Bitter melon, and we know bitter melon is, of course, a widespread herb with a herb with a widespread reputation for type 2 diabetes, and that is active. And berberine, again, in a Chinese formulation, in an animal model, induced GLP-1 by activation of bitter receptors. So there's quite good evidence that bitters do, in fact, stimulate GLP-1. And we also have clinical evidence that has followed on from that about the use of bitters to regulate metabolic function, because if they stimulate GLP-1, they're going to regulate metabolic function and help with insulin resistance. So this all suggests the role for bitter herbs in glucose homeostasis and insulin resistance, and they've used, in these two clinical trials that have been done in Japan, they've used hops as the bitter. So there was one study in patients with pre-diabetes, and there were improvements in body mass index, glycemic control, and body fat. And they were given the hop bitter acids in capsules in a double-blind randomized controlled trial. Now, some of you may be saying, I have the answer. I'm going to drink more beer because that has the bitters in it, the hop bitter acids. But there's this is quite a high amount of hop bitter acids. Probably by the time you drank enough beer to get that dose of hop bitter acids, you'd be succumbing to the alcohol and its negative effects. So no, unfortunately, beer is not the answer. In a later randomized control, a liquid hop extract, 35 milligrams in this case of hop bitter acids for 12 weeks, caused a significant reduction in visceral fat. And there's also the problem, of course, with the caloric intake you're going to get from drinking beer. So no. Now, we've done some experiments of our own, and we've used a model of enteroendocrine cells. And you can see we've modeled gentian, feverfew, and wormwood together. And if the graph goes high early, you see its log concentration down the bottom. So if the graph goes high early, then you're looking at very high activity. We found feverfew, gentian, and wormwood do increase GLP-1 secretion in a dose-dependent manner, and so it's great to use a combination of those three herbs. But surprisingly, feverfew was the most potent. Now, EC50 is the concentration that produces half the maximal response, or 50% of the maximum response. And you see that, look at feverfew. It was 10 times more active than the gentian. And those are concentrations that you can readily achieve through oral ingestion of these herbs. I'm going to now talk briefly about cellular and systemic targets in type 2 diabetes. I will list these two classes reasonably extensively, but just focus on one or two aspects. So if we look at our cellular targets in type 2 diabetes, Sirtuin-1, but highlighted in yellow because it's so important, is AMPK. NF-kappa B, because we know that type 2 diabetes is an inflammatory condition. G protein coupled receptors, that they help modulate glycemic responses, similar to the way incretins work. You mainly favorably stimulate your G protein coupled receptors by dietary fiber, producing short-chain fatty acids. So most of these GPRs that are relevant in type 2 diabetes are sensitive to short-chain fatty acids, especially butyrate, and highlights the value of fiber. 11-beta HSD1, you can manipulate that with licorice, and that's why licorice has some value, but you do have to watch, of course, the blood pressure issue. So it's not to be used in anyone who has existing high blood pressure, but it can be a useful target to help correct metabolism in type 2 diabetes. Mitochondria, and particularly the mitochondria target PGC1 alpha, NRF2. I'm always talking about NRF2, so I'm surprised if you haven't heard about it, but I will be talking a little bit about it again. And adipokines, and or adipokines, they are the hormones that are released from fat tissue. And there are some negative ones, like certain inflammatory cytokines, but there's some positive ones, like adiponectin, which I'll talk about. So this is a very important structure, diagram, because it touches on a number of things. But essentially what you're seeing is that calorie restriction, exercise, polyphenolics all help stimulate Sirtuin-1 and AMPK pathways. And that flows down to, that's in the center, that flows down to improving mitochondrial function, which is very important to do in type 2 diabetes. You also see to the left a blocking of mTORC1, and that helps with blood sugar control and the negative metabolic consequences of insulin resistance. You also see over the right that your NRF2 herbs feed in on mitochondrial health via PGC1 alpha. I've defined what PGC1 alpha is for you, but it'd take too long to read it out. But it's there on the left. And you see the NRF2 herbs also feed into PGC1 alpha to boost mitochondrial health as well. So you can see that a lot of these key cellular targets can be stimulated by just a few herbs, targeting sirtuin-1, AMPK, and NRF2. And there's actually one herb that one phytochemical that targets sirtuin-1 and AMPK, and that's resveratrol. Berberine targets AMPK, and curcumin targets AMPK and NRF2. So you can see you can readily do that with just a few key phytochemicals. So I'll elaborate on that soon. So inflammation in type 2 diabetes, as I mentioned, it's an inflammatory condition. Type 2 diabetes has been strongly associated with elevated levels of inflammatory cytokines and low levels of this important hormone from fat tissue, adiponectin. And in fact, it's considered to be a low-grade inflammation, commonly referred or recently referred to as meta-inflammation, and this inflammation is thought to contribute to both the development of type 2 diabetes and insulin resistance in the first place and its complications. And this similarly resembles inflammaging, this low-grade inflammation associated with aging, and it's thought that there's possibly a common cause for both of these issues. So this is where we bring in curcumin, because we know it's anti-inflammatory, don't we? But also it helps with adipokines. So we have from this clinical trial, randomized controlled trial, you see boosted serum adiponectin and lowered serum leptin, which is another adipokine. Now, you might think, oh, leptin turns off appetite, so lowering serum leptin, that's no benefit. But what you find in people with type 2 diabetes is they have a phenomenon known as leptin resistance, and their leptin is too high and they're resistant to its benefits. So the fact that this is lowering serum leptin probably shows an improvement in leptin sensitivity. Anyway, it's all happening the right way with the curcumin, and you see insulin resistance is going down, even total body fat and visceral fat is going down. And another similar trial where piperine was used to help bioavailability. There's better technologies than that, as you know, and we work on the Fenugreek extract to do that. Oh, I certainly do in my clinic. And again, you see a significant rise in adiponectin and a drop in leptin resistance. Let's now look at some systemic targets in type 2 diabetes briefly. Gut flora and dysbiosis I will elaborate on. Environmental obesogens, endocrine disruptors, so here we're talking about various persistent organic pollutants. Some scientists in the field have even suggested that the exponential rise in type 2 diabetes that we're seeing is due to environmental toxins. So always keep that in mind, and you can do a detoxification, for example, as a module, for 2-3 months if you believe they're at play. Microcirculation, we've already discussed. Brown fat, and that's a story that's still unfolding, but there is quite a suggestion that green tea, for example, can help the browning of fat, because brown fat, metabolizes energy into heat, and dietary energy into heat, and therefore it doesn't get stored. And that's very good for metabolic balance and insulin resistance. Visceral adiposity is, part of that story, and I'm sure Beres has mentioned that as a factor. Stress and coping are part of it. A high serum ferritin, too much iron, seems to have an adverse effect on insulin resistance, and so does too much uric acid. And you've already heard about oral hygiene and periodontitis, and that's quite important too. So let's now just look at dysbiosis drives the type 2 diabetes inflammation, and that can be oral dysbiosis, not just gut, but we'll look at gut. A couple of studies, but one particularly significant study showed an inverse correlation between microbiota epithelial distance, indicating bacteria invading the gut wall, and markers of insulin resistance in type 2 diabetes. This microbiota epithelial distance was reduced by almost threefold. I'll show that in a diagram next. It's also thought that the dysbiosis is an underlying cause of the low-grade inflammation that desensitizes metabolic signaling and impairs insulin and leptin receptor signaling. So focus on the gut. The GI flora balance protocol is quite important to do from time to time. And in a randomized control, it was found that when dietary fibers were supplemented, only a select group of short-chain fatty acid producing bacteria were activated and produced more short-chain fatty acids, and that led to improvements in HbA1c, partly via an increase in GLP-1, but as I mentioned, these short-chain fatty acids also act on other receptors, these GPR receptors 40 and 41, I think in particular. And that's it diagrammatically, and you see on the left in the control patients, you've got the pink, which are the cells lining the gut wall, and then the green is the mucus, and then the bacteria sitting on top of the mucus. But you see in type 2 diabetes, the bacteria invade that mucus, become much closer to the cells lining the gut wall, and that is pro-inflammatory. Let's now look at managing type 2 diabetes and its complications with herbs. And I've headed this slide, managing type 2 diabetes complications, but in reality what we're doing is we're managing the whole thing with the points summarised in this slide. And of course, that's going to lead to our main objective, which is to manage the complications. So diet and lifestyle. So we could do separate presentations on diet and lifestyle, but look, essentially it's about exercise and weight loss, and especially weight loss around the middle. So anything that's going to help with that. And there have been studies out of Scotland now that have shown quite clearly that if a person can lose around about 20 pounds due to some sort of calorie restricting diet, then in the more than 50% of cases, the type 2 diabetes will reverse. It is a reversible condition because especially they'll lose that visceral fat, that fat around their liver, that fat around their pancreas. Better glycemic control. Look, it's still a target, but as I said, it shouldn't be a target just on its own. And we do have a range of herbs, in fact, quite an extensive range of herbs now that have been shown to be effective for glycemic control in placebo-controlled or drug-controlled clinical trials. We want to reduce the inflammation and oxidative stress. It's a real driver of many of the negative consequences of long-term type 2 diabetes. So we're going to use bioavailable curcumin for that and our NRF2 primers and so on. As already discussed at the beginning, we're going to support microvascular and endothelial health, and I will have included the diet in this presentation, the 5-point phytonutrient diet. And then as appropriate to the case and as appropriate to what you have available to treat the patient with and what the patient is comfortable taking, look at other cellular and systemic targets, but particularly look at lowering uric acid, supporting mitochondria. You'll do that with NRF2 and curcumin anyway, and correcting dysbiosis. And of course, don't forget environmental toxins could be at play in many patients with type 2 diabetes. So the 5-point phytonutrient diet, when I started off advocating this diet, I had some very specific applications in mind, and type 2 diabetes was certainly one of it. So it's very core. All of my type 2 diabetes patients do get it. I may not have mentioned that in the cases coming up, but everyone gets it. And now I think it'd be fair to say that just about every patient gets it because I'm seeing benefit in it in so many different conditions now. So first is boosting dietary nitrate with beets as juice or a supplement and green leafy vegetables, especially spinach. Increasing your cocoa intake. It can be cacao if you don't like having fun, but cocoa is for me. 90% chocolate, or you could have the straight cocoa, about 0.7, even up to an ounce a day. 3 to 4 ounces of mixed berries. The blueberries, of course, very particularly valuable in type 2 diabetes, but mixed berries are good. Raw crushed garlic, a half to a clove a day, and generally increase herbs and spices in the person's diet, as herbal teas and also spices in the food, but with particular emphasis on green tea. And if the person can drink 3 to 4 cups of green tea a day, even 2 cups of green tea a day, that will be hugely beneficial. Turmeric and ginger added to the diet. So generally, I encourage patients, when I put them on the bioavailable curcumin, because it's curcumin is isolated from the turmeric, I think it's good for them to get some of the other natural phytochemicals that occur in the turmeric, and they can do that via their diet. So generally, anyone I put on the bioavailable curcumin, I advocate that they have turmeric in their diet as well, and ginger in the diet too. And just to highlight the green tea aspect, there was this study, drinking green tea and coffee daily is linked to lower risk of death in people with diabetes. 4 or more cups of green tea or 2 or more of coffee, interesting, have been linked to 63% lower all-cause mortality. And I think it's the phytonutrients that are in the coffee that, of course, doing this. This is not a caffeine-related effect. It's about phytonutrients. Our NRF2 activators, I've spoken about this many times, but you see the bioavailable curcumin, the turmeric, whole turmeric, rosemary, green tea and grapeseed. I use that in combination, but we've also got garlic, ginkgo and resveratrol. They're all excellent NRF2 activators. You may read about people advocating others, and some are credible, but there's a lot of misinformation developing now from optimistic extrapolation of test tube research. This list is selected because most of these herbs have shown clinical indications that they are NRF2 activators, not test tube, clinical. Now, for better glycemic control, we should employ a number of strategies. We all know about glycemic index. Well, so glycemic index and glycemic load, which is related, is basically how quickly and how much of that sugar gets into your bloodstream when you have a particular food. And we know we should, of course, prefer the low glycemic index foods. But what they're realizing now from the research is that it's not just the nature of the sugar-producing component, that might be starch or sugar itself, that determines the glycemic index. It's all the other associated phytochemicals that's in the food influence the glycemic index. And the third key factor now is the gut flora, a person's gut flora. So a food that has a certain glycemic index in one person will not have the same glycemic index in the next person if there are differences in their gut flora. So it comes back to the GI flora balance protocol and looking at gut flora. So what we can do is we can turn any meal into a low GI meal by providing those phytochemicals that slow down the release of food from the stomach and also its subsequent absorption by the intestinal cells. And the key ones there are grapeseed, green tea, gymnema, and your sticky fiber herbs, mucilaginous herbs, so slippery elm, but if you look at dietary, it can be okra and eggplant, for example. All of those will help lower the GI of the meal. So, if your patients are good at drinking the green tea, they should drink it before they eat because it will lower its GI, it will flatten the blood sugar curve, and that is very beneficial. We should also use bitters to enhance the incretin response, and that can even be taken in the form of a bitter herb that's drunk before the meal if the patient doesn't want another pill. But we do have that wonderful combination of gentian, wormwood, and feverfew that's been shown experimentally to enhance the incretin response. And then we have a range of herbs and nutrients. You know, we know about chromium, of course, on the nutrient side, etc. And a whole range of herbs that I mentioned that improve glycemic control. So as you can see, it's a three-pronged approach we can take to achieving better glycemic control. Now, this is a really interesting one because what they found was that even chamomile tea before a meal impacts carbohydrate digestion and improves glycemic control. So in other words, the chamomile tea taken with a meal is changing the glycemic index of the food. So the flavonoids, presumably in the chamomile, do that because they're talking about the compounds that give it the yellow color. That's flavonoids. And they could be used for medical purposes. Well, hallelujah, you can live in hope. So something as simple as chamomile tea, if they don't like green tea before a meal, will help with that, lowering the GI of the meal. So I mentioned a range of herbs that help with glycemic control. And the first one we should look at, which is a seriously good one, is the black cumin seed. And you can see highlighted in the table are 4 clinical trials you see on the left. And in 3 of those trials, there were people who had poor glycemic control. And you see, and typically the dose is about 2 grams a day of the powdered seed, or you can use the powdered seed extract, as I do. And if we look at the white section up the top, the first trial, you see 26% reduction in fasting plasma glucose, 16% reduction in HbA1c, 25% reduction in insulin resistance, and improvement in beta cell function. So these are quite impressive results, especially as they're in people with poor glycemic control. Now, this second trial you see in the next green section is quite interesting because it followed people at 3, 6, 9, and 12 months. So it's quite a long-term study. And you see, if we take HbA1c, for example, you see it started off at that baseline level of 8.6, and it went down to 7.9, 7.8, 7.9, and then towards the end of the trial, it started creeping up at 8.2%. Now, is that a real effect? Is it just statistics? We don't know, but it doesn't necessarily reflect that the black cumin seed is wearing off in its effect. If it is a real finding, it probably more reflects that type 2 diabetes is a progressive disease. And that's what we should keep in mind. I can remember a friend and colleague in the UK, Anne Walker, while she was at the University of Reading, we did some preliminary clinical trials with gymnema with her. And we were saying, now what are we going to use as a placebo? And because gymnema seems to act in the long term, we wanted to do a long-term trial. I said to her, and what are we going to use as a placebo? And she said, oh, you probably don't need a placebo because type 2 diabetes is a progressive disease. It's the only one of the few conditions for which the people given the placebo, you expect them to do worse over the period of the trial. If it's a long-term trial, they will deteriorate. So you don't even necessarily need a placebo. So that could be reflecting on the progression. Similar effects, same 4 trials, they also looked at lipids. And this is good because, of course, as we know, type 2 diabetes, and this is certainly something that MDs around my neck of the woods are obsessed with, that type 2 diabetes leads to cardiovascular disease, specifically heart attacks. And so if we can get a lipid control as well, then that's an added bonus. And you can see from these trials with black cumin seed that there are positive impacts on lipids, total cholesterol, LDL cholesterol, triglycerides over the time period of the trials. Bitter melon. So bitter melon, of course, is an Ayurvedic herb. It's one that I now use in my management of type 2 diabetes, for glycemic control. And we do have several clinical trials on bitter melon, and 4 of those are summarised in this table on this slide for you. Now, the interesting thing is if you have a look at the kind of cohorts that were used in the trials, in 3 of the trials, they weren't taking oral hypoglycemic drugs at all. So it's interesting to see the effect of the bitter melon, you know, on its own. And then they compared them with certain type 2 diabetes drugs, but they were parallel arms. So one taking metformin, one taking bitter melon, and the other case, it was the second green second trial, which is in the green boxes, was glibenclamide was the drug for comparison. And then they did a trial, which you see down the bottom, where it was added to oral hypoglycemic drugs. So in both circumstances, and I'll highlight this again for berberine a bit later, in both circumstances the bitter melon works. So even if they were taking a drug, you got better glycemic control, or if they were naive to drugs, you could help delay their need for drug medication. And that's certainly how I use this and other herbs in my type 2 diabetes patients. And note from the first trial in the white box up the top, results were not significant at doses of bitter melon lower than 2 grams a day. So again, you need to make sure you have an adequate dose. And in the second trial, similar results to the drug, glibenclamide. If you look at the third trial, you see quite a good reduction in HbA1c, and also a good reduction in the 2-hour plasma glucose tolerance test, and results, as you would expect, unchanged in the placebo group. Now, cinnamon. For cinnamon, the data is very confused and mixed, and a lot of the problem here is because in many of these trials, the researchers didn't know what they were using. And you see, I've got cinnamon, cassia, question mark, question mark. We've done extensive research in this because we were about to launch a product with cinnamon in it several years ago. And we discovered to our horror that it wasn't the stated species that the person supplying us the bark was saying it was. And when we dived into this problem, we found it was a total Pandora's box, and that cinnamon, the species, is widely misidentified. And the main confusion, there's a third cinnamon, which is the Indonesian cinnamon. So there's confusion between the cassia cinnamon, the Ceylon cinnamon, which is the Cinnamomum verum, and the Indonesian cinnamon. And it makes it difficult to interpret the results of the trials. If we look at those up the top, the 2 trials that stated it was from cinnamon verum, the Ceylon cinnamon, the one that we use in cooking mainly. One trial was positive, the other was not. And if you look at cassia, maybe there are 11 trials, again, very mixed results. In fact, the irony is if you look at the 6 trials down below where the species of cinnamon used wasn't defined, those 6 trials give the most consistent results in terms of effect. But even then, it's mixed. So what one needs to do here to use cinnamon effectively for blood sugar control is use something that has been targeted for what are thought to be the key actives that are doing the work in cinnamon, and they are the procyanidins. And that's what we've done, and we have a select cinnamon verum species high in procyanidins for the activity in our product, and we believe that's what's going to give you the therapeutic results. Fenugreek, there's reasonable data for fenugreek. The seed extract for 2 months significantly improved glycemic control and lowered triglyceride levels in newly diagnosed people with type 2 diabetes. Another trial shows that it improved fasting blood glucose and HbA1c. And this was over 12 weeks in people who are unmedicated with drugs. And it also helped with lipids. And also the active component in fenugreek extract, or one key active phytochemical, I should say, in fenugreek extract is an amino acid derivative, 4-hydroxyisoleucine. And that's been shown clinically to reduce spontaneous dietary fat consumption in healthy overweight volunteers. So using the fenugreek, we are possibly getting some metabolic changes and indeed some appetite regulation. Gymnema, of course, is very, very core. We had a period recently where, unfortunately, I ran out of gymnema because I couldn't get any, and from my supplier, and you know who my supplier is, and I noticed a big difference in my patients, and I was getting feedback from my patients about how they were missing it. So I think gymnema is still very, very core for helping with type 2 diabetes and glycemic control. It's been known for thousands of years in India as gurma, the sugar destroyer. And they're aware of type 2 diabetes and diabetes in general because in Ayurvedic medicine, they taste the urine. The urine's sweet. They knew there was some condition going on, which we now call diabetes. And we know that a great party trick, when applied to the mouth, it anesthetizes the sweet taste buds for several hours. That's now being shown to have benefits in clinical trials in appetite modulation. So if the patient can suck on that gymnema tablet, then that's probably a good thing for them to do if they don't mind. I've mentioned that about the sweet urine. So let's have a look at this trial. It's done quite a while ago now, or more than 30 years, but it's still, I think, a very significant trial in terms of our understanding of gymnema. Firstly, the dose. The dose was 400 milligrams of a gymnemic acid isolate, roughly, but that translates to about 12 grams of herb a day. So you need quite a high dose. So that's 3 of the tablets that I use a day, 1 before each meal. I find they work best before meals. And look at the results over time. So if we look at just HbA1c, you see it started off at 11.91, and then after 8 to 10 months, it dropped to 9.71, and then after 18 to 20 months, it dropped again. Whereas if you look below drugs alone, it actually went up over 10 to 12 months because it's a progressive disease. So very impressive results for the gymnema, make it a very core treatment. Let's not forget ginkgo, because ginkgo has surprising value in type 2 diabetes, and it's an NRF2 herb. So you're killing 2 birds with 1 stone, or maybe reviving 2 birds with 1 medicine. It shows a resuscitation of your pancreatic beta cells and increases their activity in type 2 diabetes as measured by C-peptide responses, in case you don't know. So when the body produces insulin, it produces a long protein and then it chops a little bit off to activate it, and that fragment it chops off is C-peptide. So you can measure C-peptide, and that reflects on the person's endogenous insulin production. So this was a very interesting trial that was done, as you can see, not so long ago, just 2018. And it was the efficacy and safety of ginkgo added to people who, with type 2 diabetes, who weren't effectively managed by metformin. And look at the results, they're quite amazing. Just from ginkgo, you see HbA1c at the end of the trial was 7.7%, whereas at baseline, starting off, it was 8.6. So 8.6 down to 7.7. Similarly, fasting glucose, 194 down to 155, and insulin, improvements in insulin dropping down, so less insulin resistant, just from ginkgo. Korean ginseng has also shown improvements in glycemic control in type 2 diabetes patients, but it seems especially good at lowering fasting insulin. And it might be because the ginsenosides, that are the active components in Korean ginseng, might improve GLP-1 secretion. As well as high-level evidence from a meta-analysis that it reduces fasting glucose and insulin resistance. It also helps with lipids, so lowering triglycerides and LDL cholesterol. Curcumin is also valuable in glycemic control. So this meta-analysis looked at, as you can see on the left, it's a little bit small. It looked at curcumin, pure curcumin, curcuminoids, and turmeric. And you see that vertical line going through the middle, that's the no effect line. So you see turmeric on its own didn't have much effect on glycemic control, but both the curcuminoids and the curcumin, see those diamonds clear the no effect line to the left? That means that they had significant therapeutic effect based on a meta-analysis of those clinical trials. So we have high-level evidence that curcumin and curcuminoids, but not turmeric, will help with glycemic control. And if you make that, and there's an example of the diamond I'm talking about, and if you make that curcumin bioavailable, you'll probably get an even greater effect. They're the two diamonds for curcumin and curcuminoids, clearing that no effect line. Berberine. We're not done yet. You can see we have a world of riches when it comes to herbs that help with glycemic control. And berberine is highly significant because it acts via this pathway known as the AMPK pathway. So what's AMPK? It's via AMPK that a low cellular energy status, which is a high AMP to ATP ratio in the cell, you get AMPK then, if that happens in the cell, AMPK then switches cellular metabolism from the ATP-consuming anabolic pathways to the ATP-producing catabolic pathways. So as a result, at a cellular level, it regulates an array of biological activities, and this results in normalization of lipids, glucose, and energy. It's highly significant. And so AMPK being underactive is implicated in metabolic syndrome, type 2 diabetes, and indeed cardiovascular disease as well, which we know follows from type 2 diabetes. So if we look at the world of chemicals, only a few agents are known to activate AMPK. Now, from the natural world, we have berberine and resveratrol, and the best known drug example is metformin. And we now find that these biohackers, are taking metformin because of its AMPK effects, and they want to live to 100 years, and that sort of thing, by activating AMPK. But in my view, you can do it much more readily and safely with your natural agents, so your berberine and your resveratrol. Now, in addition to the short-term cellular effects that I mentioned about AMPK in terms of energy and ATP, AMP, it has longer-term activity by regulating the production of key proteins involved in cellular energy. And what that results in is a range of benefits. And you can see in this diagram these huge benefits of stimulating AMPK. If we start up the top, healthy protein synthesis, glucose metabolism, which is our subject today, anti-inflammation, it's also relevant to today, anti-aging, redox regulation, so that's regulation of oxidation reduction, free radical damage in the body, and then lipid metabolism. So much of this is relevant to the total picture of type 2 diabetes, isn't it? So you can see that it's probably very important to use berberine as it is a natural agent that helps with glycemic control, but does it via this very important AMPK pathway. So this diagram I've shown you before, and you see it's berberine, resveratrol, and curcumin that we're going to be using to stimulate, in particular, the AMPK, the berberine and resveratrol, berberine, resveratrol, and curcumin all stimulate AMPK, but particularly the berberine, it's only the resveratrol that stimulates the sirtuin-1 that's above the AMPK. So what evidence do we have? It's quite impressive. A lot of this research done in China. So from that research, there was a systematic review and meta-analysis that was done, published in October 2012. 14 trials in over 1,000 people, 11 of them were published in Chinese. You see quite a range of doses of berberine. I generally tend to go up only to 800 milligrams a day, and you can enhance its activity by adding another herb, which I'll describe soon, if you want to get more than that. Or you can use that enhancing herb all the way through. But I go up to 800 with the enhancing herb. And treatment periods were 8 to 24 weeks. And it showed that berberine with lifestyle modification was more effective in lowering fasting plasma glucose than lifestyle modification alone. It was better, berberine was more effective than placebo in reducing postprandial plasma glucose and HbA1c levels. And when compared with the drugs, it was as good as the standard hypoglycemic drugs in terms of lowering fasting blood glucose and HbA1c. So you can see this from the meta-analysis, and this is an extra point that I've pulled out of that paper, an extra finding, and in this finding they compared berberine plus oral hypoglycemic drugs versus the same hypoglycemic drugs alone, and as you can see, the diamond point, the diamond clears the no effect line very, very clearly. So what that's saying is that when you add berberine to people taking oral hypoglycemic drugs, you will still see a marked additional clinical effect. Now, there's been a more recent systematic review and meta-analysis that was published in 2019, and there were 28 trials in over 2,000 people. These were all trials done in China. And the pooled data from the meta-analysis showed that berberine compared to control groups, showed better reductions on fasting plasma glucose, postprandial plasma glucose, which is a valuable thing to do as well, and HbA1c than the control groups. And similarly, again, berberine combined with the oral hypoglycemic drugs was better than either berberine or the drug alone. I mentioned we can augment berberine's activity, and what we use there is the milk thistle, and the silymarin component of the milk thistle is what does the work. And this has been shown in clinical trials where berberine, 1,000 milligrams plus silymarin, was assessed in 26 poorly controlled patients with type 2 diabetes. And after 90 days, again, significant reductions, HbA1c and so on. Insulin resistance dropped 26%. So in terms of other herbs that are useful, you know, our riches continue. We have ginger, and these are all meta-analyses, right? So they're pooled data from multiple clinical trials, and I've given you the number of trials in each case. So ginger, 10 clinical trials showed significant benefit in glycemic control. It lowers HbA1c by 1 unit. Garlic improved glycemic control and lowered lipids. 9 trials. Resveratrol, 9 trials, improved glycemic control and insulin resistance, and also lowered blood pressure. And even the milk thistle on its own is active. 5 trials, significant reductions in fasting blood glucose and HbA1c, but no effect on lipids. So this range of herbs with good clinical evidence that they can achieve excellent glycemic control gives us the versatility, so we can mix and match to the patient and overlap. So if they want their memory improved and they've got type 2 diabetes, we can give them Ginkgo because that'll help both of them. They've got a fatty liver and they've got type 2 diabetes, we can give them silymarin, the milk thistle, because that'll help with those. So we can use this data to mix and match. They've got high blood pressure, we can give them the resveratrol and the garlic because that'll help bring their blood pressure down. So I'm not saying every patient with type 2 diabetes should have every one of the herbs I've listed, but this menu that we have, and there are a couple that are core, which is, the black cumin seed and gymnema I would regard as core, but we can mix and match accordingly depending on the person's needs. So we've packed in a lot of information over the previous hour. So before we move on to cases, let's have a quick summary of the herbs that are key and their properties. So this table on this slide lists the key herbs and key nutrients for type 2 diabetes, together with supporting herbs and supporting nutrients. And you see many of these I've spoken about already. So a little bit more detail on those key herbs. We've got Nigella, bitter melon, fenugreek, and I've given you the reasons for those key herbs. Then ginkgo, gotukola. They're not necessarily in any order, but you can see that with many of these herbs, we're hitting multiple targets. And of course, with the bioavailable curcumin, you see probably the most targets of all, including glycemic control and including, because they're NRF2 activity for the bioavailable curcumin, detoxification, in line with what I was saying before about persistent organic pollutants. So this is just a summary for you to refer to. And if you look at how you might apply that in clinical scenario based on combinations, there's some core treatments that I think we should focus on, and I've highlighted those. So we have the black cumin seed, the bitter melon, cinnamon and fenugreek, which you can use in combination, together with gymnema or the philodendron as a source of berberine. But you can give all of those three if you feel the person needs that very focused glycemic control. And then you have the bioavailable curcumin, especially if inflammation predominates, and it can be and as well, you can look at that bitter formulation with the gentian, wormwood and feverfew for the incretin effect. And then other things to keep in mind that could be relevant for the person is that combination of the polygonum with the resveratrol, ginkgo, milk thistle, St. Mary's thistle, milk thistle, then the rosemary, green tea, turmeric, grapeseed, I mentioned that in one case. The gotukola, ginkgo and grapeseed, I mentioned that for the microcirculation. Korean ginseng, we know, is very good for glycemic control. So if they're low in energy, a bit flat, you can use the rhodiola and Korean ginseng. And as I mentioned, if, say, you want to help with lipids and blood pressure, you can use garlic. So they're all relevant. And we can basically assign a pyramid of how we strategize treatment for type 2 diabetes. But I've got the note there you see at the bottom, always be guided by the clinical features of the case. So our foundation is diet, exercise, stress and weight management. We also need to keep in mind the increased cardiovascular risk. And then we go to the cellular and systemic targets, look at any comorbidities, and if they predominate, help address those. But the main focus is, up the peak of the pyramid, is blood sugar and microcirculation, as I emphasized at the very beginning. So let's now finish off quickly with some case histories. So I've been using berberine, basically deriving it as an extract of the herb, Chinese herb, philodendron, in patients with both elevated total and LDL cholesterol and blood sugar, typically type 2 diabetes, of course, in the latter case, and seeing good clinical responses in lowering all of these parameters. And so that's one huge advantage of the berberine, is that it will address the lipids as well. And we know that people with type 2 diabetes, the lipid targets that they set, that medicos set for them, are much, much lower than for someone else because of their much higher cardiovascular risks. So here's a brief example case history of that. Male patient who'd had type 2 diabetes for 4 years, he's 61. He'd been treated with various natural products and drugs over 3 years, but by May 2012, his fasting blood glucose level was particularly high, excess of 144. So when I gave him just the phalodendron on its own, I think 3 tablets a day, so that's 600 milligrams, they're 200 milligram tablets, you see it dropped substantially to between 108 and 126. And commensurate with that, his HbA1c had dropped from 7.3% to 6.2%. There were some changes in his drug medication, but I think it was largely the berberine that was doing it. And just this brief case history to emphasize the important point, these things do work, they do work. So here's another more fleshed out case history of a male patient who was 67 years, presented with type 2 diabetes, persistently high fasting blood glucose, and I mean high, 240 milligrams per deciliter, HbA1c of 8.3%. And he was on metformin and sitagliptin. He was overweight, 115 kg, so that's 230 pounds. He was taking a proton pump inhibitor for reflux. He had ALT and GGT elevated, so most likely had a fatty liver. So naturally, I'm giving him the 5-point microcirculation diet, as I want to emphasize I do in all my type 2 diabetes patients, together with more exercise, reduced carbs, lower GI diet. And for herbs, I gave him the gymnema tablets, the bitter digestive formula for the incretin effect. I gave him the milk thistle tablets because of the fatty liver. And with these, just these 3 things, his fasting plasma glucose was still high, but it dropped from 240 to around 160, and his HbA1c dropped to 7.7%. Now, equally significantly, he lost about 5 inches from his waist and 11 pounds from his body weight. And naturally, because his fasting plasma glucose is still high, still high at that level, I've added the black cumin, cinnamon, bitter melon, and fenugreek, and that's helped cause further reductions. So the third case history, this was a younger, again, male patient, 56 years old. He had boils that didn't resolve fully after echinacea treatment. And when I looked at him, he had some muscle wasting in his legs and buttocks, and I thought he might have undiagnosed type 2 diabetes. He was sent for a blood sugar test, and indeed his HbA1c was around 12%, and his fasting plasma glucose was 290. And they wanted to put him on insulin right away. They didn't want to do the oral hypoglycemic drugs at all. But he resisted and came to me for help. So I recommended a low-carb diet and exercise, and I said, your mantra from now on is exercise or insulin. So we held that insulin bogey above his head. So again, he got the gymnema, and he got that formula with the polygonum, the giant knotweed, grapeseed, milk thistle, ginkgo leaf, and Korean ginseng, one before each meal for both. And then that grapeseed, turmeric, rosemary, and green tea NRF2 formula, because not only is it targeting NRF2, I had him have one before each of his 2 main meals because it's lowering, the glycemic index of the meal, as discussed, earlier on, with the green tea and the grapeseed in particular, those 2 components plus the NRF2. And with this treatment, his fasting plasma glucose went down to 120 and his HbA1c around to 7.5%. Now, it is a progressive disease, type 2 diabetes, so it started to creep up again, and he had problems with his blood pressure as well. So I added the coleus. I gave him the coleus for scoliae, and with that, and with exercise, his HbA1c went down again to 6.5%. So just acknowledging various contributors to this presentation who helped with either the research data I showed you or the information in the presentation. Thank you, and look forward to your questions at question time.